Hello, all my friends out in TV land. This is Senior Issues, etc. I'm your host, Vita Verdon, and I'm taping this show on March 16th, 2015, on a Monday morning, and spring has sprung. This is the first day after such a horrendous winter that the temperature is supposed to get up to 75. I say, yippee, hallelujah. Now, hurry up, get your coffee, get your tea, get your Coca-Cola. Take a pencil and paper with you. You know, I listen to all your requests, and I know what you need out there. Over the last 15 years, we've become the best of friends. And sit down, because I have a very informative guest with me today, and she's going to give you information that you need for your life to stretch it. That's our goal. Remember that. Now, the guest that I have with today, her name is Janet Fryer, and she is a representative of an organization. She's actually a counselor for them called SHIP. That spells ship. And you know what she's going to tell us? She's going to tell us what SHIP means. Good morning, Janice.
Good morning.
Afternoon. I have to say good morning, good afternoon, good evening, because the show is seen in so many different times.
Okay.
It's so good to have you with us. I know that the producer of the show, Gloria Shapiro, and myself have used your services, so we know of your expertise.
Yes.
And so, first of all, before we get started with the information that you have within you, that what I'd like you to do is, I know these folks out here, our audience. I've gotten to know them over the last 15 years, and they just like to know a little bit about you.
Sure. I'm actually from New Jersey. I've been out here for 25 years. And when I moved out here, I was working in the business world, and I was finding it not very satisfying. I decided I needed to help people, so I went back to school and I got a degree in counseling. And now I work at Dickinson Hall, which is a senior center serving Lake Forest, Lake Bluff, and Knollwood. And I am a senior advocate there, and I am a SHIP counselor, which stands for the Senior Health Insurance Program.
So the Senior Health Insurance Program, now, does that mean you help people decide what kind of insurance that they should get?
I help people with Medicare. I help people figure out what Medicare is all about and what programs they need to be in, what products, Medicare products they need to be in. And often people come to me when they're first deciding what to do about Medicare, they're first turning 65.
So people like come to you when they're first going on to Medicare.
A lot of them do, yes.
A lot of them do, and then people come to you if they have trouble in decoding what kind of policy that they should get?
Yes, when people first go on to Medicare, they do not necessarily know what Medicare covers or what it doesn't cover, and that in addition to Medicare, most people get a supplement to cover what Medicare doesn't cover. And also there are drug plans that are new in the last, I'd say, 8 years that cover people's drug insurance.
Now, I know you also do some work for Family Service.
Yes.
Maybe you could explain briefly. We've had somebody on from Family Service. Maybe you could briefly tell us a little bit about Family Service.
I actually work for Family Service, and Family Service, their full name is Family Service Prevention, Education, and Counseling. They're a social service organization that's based in Highland Park and has offices in Barrington, Highwood, and Wakanda, and other offices. They offer counseling from youth, through adults, through seniors, And they also have a center serving Latinos, offering bilingual counseling. They're serving children through from elementary school through high school, and also offer some services linking people with resources, especially for financially disadvantaged people.
Oh, might I ask you a question? Exactly who is eligible for family service?
Anyone, really.
Anyone is eligible.
Yeah, well, family service has some grants and can help some people based on grants, but also is, like any counseling organization, is collecting fees for their services. So they can help anyone, regardless of their income, to get services at an affordable cost.
One thing I want to mention right now is that any of the subject matter that we're going to discuss today, I think you're going to give out a website of the Department of Aging.
Yes.
And now, see, we're going to be talking about a few different subjects. So anything that you want to ask questions about, Janet is going to give you the direct line for the Department of Aging or their website. What are you going to give them?
Well, let's start with the website.
Okay.
If you're interested in accessing SHIP information, again, that's a senior health insurance program. The website for the Department on Aging is illinois.gov/aging/SHIP. And if you are interested in getting information over the telephone or getting referred to a SHIP counselor in your area, you can call the Department on Aging at 800-252-8966.
Now, you know, we're going to give this a few times during the show because of giving out all this information. But what I'd like you to talk a little bit about is Medicare.
Sure.
Because I think that we need to have some information on them.
Okay.
Okay?
Sure. Medicare actually has 4 parts. When people turn 65, assuming they have about a 10-year work history, or their spouse has a 10-year work history, they're eligible for Part A, which covers hospital insurance and some nursing home stays. There is also Part B, which is doctor's services. You can delay signing up for Part B if you have insurance through your employer. Many people delay signing up for Part B because there's a premium associated with it, which is $105 a month currently, and can be higher for higher income people. When people sign up for Part A and Part B, they often sign up for drug plans. The drug plans, they run around $30 and up per month, and they cover drugs and one of the concerns about both Part B and Part D, which is the drug plan, is if you don't sign up when you're first eligible, there can be penalties. For Part B, the penalty.
Excuse me, financial penalties?
Financial penalties.
Okay.
For Part B, if you don't sign up when you're eligible, the penalty is 10% per year that you delay. That's a markup on the premium. And
that's a lot.
And it doesn't go away, unfortunately. So people need to be aware that they can delay signing up for Part B if they have health insurance through their employer. But if they do not, they should look into whether or not they need to sign up for Part B to avoid a penalty. And the other thing about the Part B penalty is if you have COBRA.
Would you define what COBRA is?
COBRA is health insurance that you contract for when you leave an employer. You can continue as a private pay.
A private pay?
Yeah, to pay for your health insurance.
Okay.
But people on COBRA do not get any kind of special enrollment period for Medicare Part B. So if you're on COBRA, you need to be aware that you are possibly facing penalties if you delay signing up for Part B.
So you have to be really discreet in doing it within the gauge that you're given.
Yeah, you do if you don't have group health plan through your employer.
Okay. And so people really need to be aware about these details.
Yes.
Within the Medicare field, right?
Yes, yes.
And I suppose that in your doing, this takes up the majority of time that people are unaware of or do not have enough information on.
This is what people come to me to learn about for the most part.
Because they don't know how it works. Well, I was in a bind, and I was unaware of what my rights were or what was going on. And that's how I originally contacted you.
Yes.
And that you brought me through the maze. I call it a maze.
Yeah.
Because I wasn't aware of what was going on. We're going to get back to this, but now it's time for Vita's Pearls of Wisdom. All right, one thing that I'd like to talk to you about is that recently we just got some, that we have Comcast who is filming our show, but there are a certain amount of expenses. And I want to give myself and the whole crew our heartfelt thanks to the Libertyville Senior Center, who just recently gave us a grant with some money that we could go on for another year. And I want to give credence to this, to the number one, the president, who is Jim King in Libertyville. And the thing I'd like to say is this, that they have believed in us and supported us for the last 15 years. And this show is brought to you, we're a community service. We don't have any ads, we don't have any sponsors, and I've never tried to sell you anything. What I'm bringing forward to you is information to enrich your life that you're not getting from any other channel. And we do have a certain amount of expenses. Our crew here, we're a crew that we're all volunteers. Nobody is getting paid for it. So it takes a certain amount of funds to produce this and to continue on a yearly basis. So we give thanks to the Senior Center, to Jim King and the whole Senior Council, that they have believed in us all this time, and it's because of our donor, our sponsor, that they have sponsored us, and it's because of you out there, our faithful audience, that have considered this to be a worthwhile show, that we have gained such a large audience. And that pleases us, because we have here the heart of a volunteer, that what we want to do, how we get blessed, is by bringing this information forward. Another person I'd like to give thanks to is the woman that runs the Senior Center in Libertyville, and that's a very lovely lady by the name of Carol Lopez. And what she's done is she has set up a program at the Libertyville Senior Center that once a month she shows one of our tapings, one of our films, and she lists it in their monthly publication, and she lists it like for 5 months ahead of time. You can tell, okay, this month it's going to be on sleep apnea, this month it's going to be on nutrition, this month it's going to be on a heart doctor, this month it's going to be the sheriff's office, and so it's listed. So she's done such a nice job of doing that, and we're grateful because that's our role here. That's what our job is, to get the word out. And in getting the word out, it's helping you and it's helping us to keep the show going. Because our dream is to stretch it, to live longer and a rich life, and to leave a legacy to the next generation that's coming after us. So if we all work together on this, And even though we have the aches and pains, we keep those little gray cells going. And what we're doing is we're using it so we don't lose it. Now I want to get back to Janet because she's got a lot more information for us. Okay, now I still want to get back to this SHIP information
Sure.
and the Medicare subject matter. So what I'm going to do is I'm going to give you a hypothetical case. And I understand that the whole insurance reform is changing very rapidly, so we have to keep up with the changes. So what I'm talking about is what's happening right now. I don't know what's going to happen in the future.
Okay.
In the future, I feel that they'll try to stop things, to change them. I told you some incidents that I was getting as a senior.
Mm-hmm.
All right, my hypothetical case is this that I'm presenting to you, Janet. Say a person is on Medicaid, okay? So being on Medicaid, they're given, the government pays their whole insurance plan,
Yes.
okay? So if a person is on Medicare and then they were given a supplementary, say that they just take Medicare away from you and they send you a policy. Say
Yeah.
this happens to a person.
Yeah.
Now, what would the person's rights be, and why are these changes coming about? Maybe you could explain that a little bit.
Well, the changes that are coming about, it's called the Medicare-Medicaid Alignment Initiative. And the goal of it, of course, is to save money for the providers of the services for Medicare and Medicaid. It's sort of like moving people into an HMO where there are providers that are participating with this alignment initiative. Early on, if you found out you were being put in this program and letters went out to this effect, it could cause a problem because if you had any medical care lined up with your doctors, you might suddenly find that you had to go to different doctors. And in the beginning, you were able to opt out of that. And I helped an individual who was facing some medical treatment and had her doctors all lined up. And suddenly she was getting letters saying, hey, maybe you can't go to your doctors. And we were able to call and get her back into regular Medicare and Medicaid. And she was able to go to her doctors to get medical treatment.
Now, one of the things, I think it is probably to save money because it's so costly. Now, I know that they advertise on television for back braces, and I get calls all the time, don't I have some kind of a pain? It's free, to get a back brace, whether I need it or I don't. It's not free.
No, it's costing Medicare money. If you don't need a product, you should contact whoever's sending you that product and say, hey, I didn't order this, I don't need this. There are some companies out there that take advantage of Medicare's rules to try to get money for products that people don't need, unfortunately.
Now, I am a diabetic, and I don't get any of my paraphernalia or any of my drug through the mail. I get it all through one stop. I get it all through Walgreens because it's convenient for me. And what happened to me this last year is I got a big box with all kinds of diabetic equipment from California. The box was sent to me from a medical supply house that I did not sign up with and that I did not order, and some expensive things in there. And I actually paid the postage because it became so complicated in trying to get a label to send it back. But that's one of the things that's happening. Now, where they get my name or condition, I don't know. But
I don't know.
I am openly, I'm not a secret diabetic, I'm an open. So there's probably several lists outside that are floating. But I want everyone to be aware, and we should have a certain conscience. It's like putting your putting your litter in certain boxes and putting your paper cans. We should be able to do this at our age, that if something comes to you, send it back, because if we don't keep the costs down, then the next generation isn't going to have anything.
Correct.
Now,
That's correct.
would you like to go, where would you like to take this further?
Well, one thing I didn't mention is Medicare's Part A and B don't cover everything.
Okay, let's go into that maybe.
And most people I mentioned they sign up for a supplemental policy.
Mm-hmm.
And if you get a supplemental policy that's fairly comprehensive, when you go to the doctor, you might not end up paying anything. You will have to pay the premium for the supplemental policy. Luckily, the policies are standardized. There are 10 of them, and they're labeled with letters. And a Plan B from United Healthcare is identical to a Plan B from Humana or from Blue Cross Blue Shield. There are many companies offering these policies, and it's easy to compare them because the policies are standardized in the benefits they offer.
So now, if a person needs help, now how should they prepare? They should have a list of all their drugs, right?
Yes.
And a list of all their doctors? Maybe you could go through that with us so they can prepare.
When people come to me to evaluate what Medicare covers and doesn't cover, I encourage them to contact their doctors. There are doctors that don't take Medicare, although it's rare, and there are doctors who will not take new Medicare patients. They'll take you if you age into Medicare, but if you're a new person coming in, maybe moving from out of the area, they may not take a new Medicare patient. When people come to me, I encourage them to bring a list of their drugs, including the dosages and how many they take a day. And I can take that information and put it into the Medicare website, which is medicare.gov. There's something called the Plan Finder, and the Plan Finder takes all of your medications and your zip code and identifies there's about 30 plans in this area, and it will calculate which plan is lowest out of pocket and rank order the plans. I know this is complex, but it rank orders the plans according to the lowest out of pocket. And there also are quality ratings on these plans, so you're not just picking the one that is lowest cost, you're picking one that you're comfortable has a good reputation.
I'll tell you a situation that happened to me is I am a diabetic, and I have in my eyes I have what they call retinopathy, and then I have glaucoma in one eye. So my ophthalmologist wrote me a prescription for a eye drop.
Sure.
Which was quite costly, and my insurance company denied it. They wouldn't pay it. And it became so complicated that my doctor actually had to call the insurance company to figure out the ingredients in the eye drop to find something. It became very complex.
Yeah.
But what we have to, as seniors, learn how to do is we have to know the history of ourself, and we have to be our own advocate.
Yeah.
And we have to be able to research where the things that are too complex for us, how to get the information that we need. That's why I'd like you to give the website again and the telephone number.
Okay.
Because I'm sure that in our audience today, we're just dipping in and giving them a little bit of information, but there's probably a whole window of questions that people have, and we would like to make it available to them.
Yeah.
Okay?
Okay, the website for the Department on Aging is illinois.gov/aging/ship. And the phone number for the Department on Aging is 800-252-8966.
Okay, and now for a person who is going to to receive help, let's go through the preparation. They should have a list of all their medications.
Yes.
And what else?
They should know whether or not they need to sign up for Part B right away, or I can guide them in that. Really, the sign up for Medicare is through the Social Security Administration.
Yes.
And generally, Part A is an automatic. You sign up for Part A automatically. And Part B, you need to sign up for. So there's not a lot of information that people need to bring with them.
There's not a lot of information.
But
now I know, okay, that's in Medicare. Now let's talk in family service.
Yes.
Okay, in family services, can they get information about that if they call the Department of Aging?
No, family service.
That's what I wanted to bring up.
Yeah, family service is a standalone, nonprofit organization, a social service organization based in Highland Park. And if they wanted to contact family service, I can give that number.
Would you mind?
No. That number is 847-432-4981.
All right, and there is a wide range of services. I know that we had a therapist come on, and then in what capacity do you work for in family service?
Well, I work for family service, but somebody said I'm posted at Dickinson Hall, which is the Lake Forest, Lake Bluff Senior Center.
All right, now there is a family service in Highland Park.
Right.
In Highwood.
Yeah.
And
Barrington.
And Barrington.
In Wakanda.
And
there are other small satellite offices.
And there's so then there's other small offices. But if you contact one of those offices, and they have a wide range of services.
Yes.
All right, and I think their charges on a family is on a sliding scale.
They have a sliding scale. They take most insurances, and they take Medicare. And there's a special program, a senior grant, so that if people have Medicare, or they don't have insurance, the senior grant can pay for their services. So there's no out-of-pocket to the senior.
Well, everybody needs help in some area, and I think that in giving these numbers out to people, that this is good information going forward.
Yes, yes.
And this is helpful to people. And the thing of it is you don't have to wait for a disaster to happen.
No.
I believe in preventative care. What I have is this, but how could I prevent anything from happening in the future?
Yeah.
We're so glad that you came with all this information. Both Gloria and I were so delighted because Janet helped us out with complicated situations. And we know that the information she's brought today, that we're going to have her on periodically so she can bring us up to date with, because changes occur all the time.
Sure.
And at first when I asked her, she, oh no, and I said, don't worry, it's going to be so fine. But now you know what it is. When you out there come to the end of your rope, you tie a knot and hang on. You know why? Because the best is yet to come. Get out there and enjoy that sunshine. Catch the spirit.